Now, in the interest of time, I'll just summarize this slide very simplistically. People obsess about bowel cancer as well, and I did at the beginning of the talk. But actually, when you look at the reasons why people have their colon removed, whether they've got inflammatory bowel disease alone or PSC with inflammatory bowel disease, our data across England has shown most cases are performed because the colitis is really active, not because of bowel cancer. And that's the same across all age groups. Most cases where the bowel needs to be removed in PSC is because the inflammation is active. One of the additional challenges with PSC is that your symptoms don't always tell us what your bowel is doing, which is why some of you may be puzzled that your doctor is offering you bowel surgery when you feel absolutely fine. And that's just to say that, you know, your symptoms don't always tell us the whole story. The other thing I just want to sort of highlight is that when you have active inflammation in your bowel, so active inflammatory bowel disease, and you need a liver transplant, those people have a much higher risk of clotting off their liver transplant, about a 20% risk of clotting off their liver transplant at 4 to 5 years. But those people who don't have inflammatory bowel disease or who have had bowel surgery to remove it before your transplant, your graft is relatively safe. But there are many types of bowel surgery, and this is a very busy slide. Again, it's one of those things that I'm not going to talk about in a great deal. But one type of bowel surgery is what we call an IPAA. Now, that's not a lager, that's not an ale. IPAA is an acronym, and the lay term for it is a pouch. It's when you remove the part of your affected bowel and then you're joined back together again sometime later. For whatever reason, your liver doesn't like that. Your liver, when you have a transplant, doesn't like it when your bowel is rejoined together. And actually, the rate at which your liver transplant will fail is much higher in those people who decide to have bowel surgery and join back together again. Now, I'm not saying that to scare you. What I'm doing is to highlight one thing. Those people who have bowel surgery prior to a liver transplant, if you keep your stoma intact, your outcomes are really, really good. And it's very, very rare that those people who've had bowel surgery, who've kept their stoma, who then have a transplant, run into any problems.